you four valves. Okay, this is why that fixation was important for you. This is right side. This is why this is tricuspid valve. Okay, this is left side. This is why this one is bicuspid valve. But if you don't remember them, just say right AV valve, left AV valve, still you will get your full credit. If you are sure this is the side, okay, so then just name like that.
Yeah.
So once you see this is pulmonary trunk, you automatically know this one is pulmonary semilunar valve.
Yeah.
Okay, but to look at the aortic valve, you have to look closely.
If you put pulmonary
It will be behind this one. You can use that also. Okay.
Semilunar valve.
So you can skip. So if I move this one, only then you see the aortic valve below it. That's where the aortic valve is.
Bicuspid.
So we have bicuspid. Below bicuspid, you can see the aortic valve. So it's not easy for me to ask this one.
The aortic
In the
is
real heart, it is still deeper. And we usually don't see it from this side. We see it from this side. We
So
cut it and we see it there.
The aortic semilunar valve, we only find it in the left ventricle.
That's
And
where
the
it will
left-
be. So it
Okay.
will be connected to left side. This one will be connected to the right ventricle always. So this is our ascending aorta, aortic arch, and descending aorta.
Right.
Okay. So after this one, we said this one will be. So I asked you to remember two words for it: ligament and artery. Okay. If you remember the word ligament, then you can change it to ligamentum.
Arteriosus.
From artery, we are making arteriosus. So you have to fix those two words first. It is ligament-like. That's why they are using word. Originally, it was artery. Blood was flowing through it in the fetus. Then it turned into a ligament. That's why we are calling it that. Similarly, we have this depression, and we are calling it fossa ovalis.
Yeah.
Okay, that's what I can ask you. Fossa ovalis. Okay. So that's what I can ask you. So
Fossa ovalis.
after this one, so then I can ask you the blood vessels connected to it. So this is pulmonary trunk. So this will be your pulmonary artery. Okay. So I will give you some leeway. So if you just say it is pulmonary artery, I'm not asking you to say left or right.
Okay.
Okay. So this one will be our superior vena cava. This one is our inferior vena cava, and they are connected to right atrium.
atrium, yeah.
That's where they are connected to.
Yep.
This is where they are dividing
Branching.
into the two brachiocephalic veins. So this will be right, this one will be left. This is where we are calling this brachiocephalic artery.
Only one.
This will be our
Common
common
carotid.
carotid artery. This will be our subclavian.
subclavian.
These two, they will belong to left side. But if you name them just like that, I will accept that.
You'll get half
Okay.
a point.
So brachiocephalic artery, carotid artery, subclavian artery, that will be good for me out of this one. And these are, if you see narrow red arteries, they will be coronary
Coronary
arteries. If you see narrow veins anywhere,
Cardiac veins.
they will be cardiac veins. That's what we are looking for. Though I told you, I will not be asking you,
Coronary
this
sinus.
one is coronary sinus, but I'm not going to ask you.
Why not? It's easy.
It's easy.